Congratulations, everyone, and thank you for being here. The winners of OHSU Inventathon Health Disparity Prize, Team CommuNutri. I'd love for you to introduce yourselves, the work that you do in healthcare.
Thank you, Kristen. I appreciate the time. My name is Carl Osborne. I am an EHR analyst and consultant. I'm also a mobile app developer, particularly in clinical informatics. What got me interested in this was that my entire family are all either pharmacists or nurses. And so I grew up with healthcare, and I had a particular interest in IT and developing applications. And so it just was natural to dabble in and find solutions to provide better patient care.
Thank you, Carl. Stephanie?
Hi, well, I'm a medical anthropologist, so by training and by interest, I study just how people make sense of illness and health. And so, yeah, I'm interested in how people experience like their well-being, and I wanted to study it in a sort of in a cultural way. So that's my background.
Hi all, my name is DANIELA RUIZ. I'm currently an undergraduate student at Reed College with the intended major of biology. I became interested in the OHSU Inventathon because I actually heard about it through Reed College, and I would like to be a future medical student and hopefully a doctor one day. So yeah.
Hi, so I'm Nicole. I'm an aspiring product manager with an interest in innovating in healthcare and education. I recently graduated with my MBA, but I have an eclectic background with an undergrad in biomedical engineering, as well as an MFA in interior architecture and design. And similar to Carl, my family is also very heavily in the healthcare world. So my overall passion to help others and inclination to just ideate creative solutions drew me to both healthcare and education, as well as like my past experiences just volunteering and working in the hospital.
Hi, glad to be here. Thanks for the invite. My name is Samuel Tassi Younger. I'm a research scientist working at Oregon Health and Science University. So there I do research on early cancer detection, but I'm also trained as a general practice physician in Cameroon, where I worked for about 2 years with local communities. So really got to understand what people go through, difficulties to access proper care. In general, I'm passionate about developing what I call simple solutions, but that are evidence-based, that are all geared towards improving the patient experience, improving healthcare, and doing so in an equitable manner. At OHSU, I'm also part of a health disparities committee, and there we are also striving to ensure that whatever products we're developing, whatever new ideas we're coming up with, we do so in a way that the products will be accessible to everyone.
Explain the idea behind CommuNutri. Where did that start from? What is CommuNutri about? We'll start with you, Carl.
CommuNutri started, the idea of it was a few years ago when I was diagnosed with type 2 diabetes. I noticed that when I'm in the hospital setting that, while I'm in the hospital, I'm getting all the nutrition, I'm getting the appropriate proportion size meals based upon my diagnosis. But it wasn't until I was discharged that I noticed that I didn't have any instructions on how to continue that. So CommuNutri is a combination of involving the community to providing a nutritional meal packet or directing you to get healthy foods within your communities, in particular the rural and the communities that are have the disparities of not obtaining health. In addition to that, it's an application that, quite frankly, when you get discharged, you can access healthy meal plans and get directions on where to obtain healthy foods.
Thank you. Stephanie, do you have anything else to add to CommuNutri, what it does, how it works?
No, I think that I guess I was thinking about the story behind it, but as far as what it does and what it is, I think what we're trying to build here is a way for people to have the connection to that same care that Carl was describing in the hospital, while also adapting it to their life and to the realities of home living. So you can't have the same type of care, but you can approximate it by cooking for yourself or knowing how to shop better, or still enjoying some of the meals that you do if you go out, and knowing that those meals are appropriate for your meal plan and your meal goals, and setting the right parameters for keeping a healthy lifestyle.
Nicole, is there anything else that you'd like to add?
I do want to add that, like, I think one of the other pieces that when we were working on this project is really looking at how we can have similar to what Samuel was mentioning, have it be equitable around individuals who can't have access to it. So we did come up with thoughts about how do we get to the individuals who might not have access to specifically the technology for an app, if there's ways that we could somehow adapt to their lifestyles and their accessibility issues. And on top of that, it's just addressing the issue not only with the nutrition, but also one of the bigger problems that we face in the world right now is food waste and the individuals that might not have access to the foods. So we tried to come up with solutions on how we could use the current resources that are available and just adapt them to other industries or other ways so that we're making the most of what we currently have at the moment.
Samuel, do you have anything else to add?
Maybe I just mentioned that, from a medical standpoint, it is well known that in order to properly manage diabetes, you don't only have to approach it from a pharmaceutical standpoint. It's, so the patient's blood sugar levels, in order to maintain them at the appropriate euglycemic state, it's not just about the metformin you give them, but also, are they exercising properly and are they also eating healthy? If you have a patient at the hospital, you're able to control what they eat, you're able to control what drugs they take. Upon discharge, they go home, they're basically on their own and they don't have help in education, knowing exactly what to eat and where to find that kind of food, and also culturally appropriate food. So I think that's where community really comes in. How do we ensure that there is this continuity of care with respect to nutritional management of the patient's condition? And how do we involve the community and make it easy for the person to access resources around them so they can eat better and also better control the diabetes or pre-diabetes?
We heard earlier Carl describing his personal connection to it, but do any one of you have any other challenges that you face in this particular problem?
Well, at least personally, I have lots of relatives that are experiencing diabetes, and I do have relatives that don't live in the US. They live overseas, and they're in areas that don't have the access to healthier food options like we do in the US sometimes. So it's like that is a personal aspect of my own that I think that if there's a way to use the community locally and be able to source fresh fruits and produce and nutrition for individuals, and if we can figure out how to do that in the US, then it can be scalable in other countries, and we can potentially help a lot of other individuals throughout the US who might not have access to the knowledge or the information that US citizens currently have to diabetes and to nutrition right now.
Thank you so very much, Nicole. So you touched on some key words, which brings me to the next question, which is around information and awareness around accessibility to food and the role that nutrition plays in disease prevention. So if you don't mind answering or bringing some awareness to our viewers of how important is nutrition and having that gap bridged.
Answer this question, I think definitely it'd probably take more of a physician or nutritionist point of view, but from, I guess, just a general understanding of how important nutrition is, we already know that there's a lot of studies out there about how food impacts mentality and physicality of individuals, and just having a broader knowledge sense of understanding what goes in the body, how it impacts you, and how it'll affect your mood or personality throughout the day is so important. And I think right now, one of the challenges is the lack of information out there. We know that there's a lot of studies going on. We know that there's a lot of information, but either some people don't have access to it, some people might not have time to read about it. So just having the opportunity to share some of that information and get it out there and make people more knowledgeable and make them more proactive about taking care of their own health, taking care of their own lifestyle and the choices that they're making is always a very important thing in my mind.
So I wanted to follow up on both of Nicole's points because just sharing a sort of like an autoethnographic bit is that my father has like pretty advanced diabetes. And so hearing Carl's story just sort of gave me, I mean, that was a linkage to the project, but also thinking about how in my discussions with my father about his diet, because a lot of it just comes down to it for him, was this idea, this disconnect between what he's supposed to be eating, what tastes good, and what he has available. And, you know, we've tried really hard to get a nutritionist consult, and it's been difficult, even though he's, you know, over 65, and this should come as an easier, I mean, he's on Medicare, he should be able to have this access. And it's not easy. And so one thing that I've been thinking about as far as this project is, you know, people know that high sugary foods or high carb foods or high fat foods aren't good for them if they're diabetic, but they don't know how to diversify their food options. And I think that this is one of the places that we can show them, you know, it's not that you can never eat a donut. It's just how much of the donut you can eat and how often. And that's where I think people need the nutritional advice, the education, and the diversity of options to say, you know, to know that they're not just stuck with eating salads for the rest of their life.
You brought up a great point there, Stephanie. And I'll just throw this to Samuel. Samuel, do you have any additional input on this issue?
So bridging the gap between awareness behind healthy food accessibility and disease prevention, and how important healthy food is to our well-being. I just want to start by throwing out some statistics there that really shows that, you know, we need to do something. You know, in the United States, there are 122 million people who are either diabetic or pre-diabetic. The pre-diabetic ones, their blood sugar levels are not that high, but they are on track to become diabetic if they don't do something with the diet. But again, we also see that a high proportion of these people, or where the rates of diabetes are highest, are in areas also that are rural. They're in areas that people have very, very low access to healthy foods. So there is a problem there. And we see that, you know, that poor access to healthy foods, you know, could be one of the reasons why you have these high rates of diabetes in these areas. And from a medical standpoint, what you eat, your body is like a factory that functions based on what just comes in, the raw materials that come in. So it's important what you put in your body. Diabetes, for example, and specifically, it's a disease of disturbance of blood sugar levels. Your sugar levels are high, and that could be one, because you're eating a lot of sugars, or two, because you're not metabolizing the sugars that you have because of high fat content in your body. So finding ways that you can reduce the carbs and also reduce the weight through diet is important. But again, the whole point about CommuNutri is, how do people do that? How do people do that while still eating what they love? How do people do that in a way that doesn't get them stressed out? I give an example of my mother-in-law. She's from Cameroon, but she visits sometimes in the United States. She's diabetic. And similar to Carl's story, you go to the hospital, the endocrinologist will tell you reduce the carbs. But what does that mean for her? What does she eat? Does she just eat only greens? She's not used to eating only green. What other options are there for her? Where can she find those things? Is a diabetes diagnosis a new condemnation for her? She's not going to be ever happy about what she's eating. So I think those are important questions that I see CommuNutri really stepping in to address and help improve the general outcome and lifestyle of patients.
Adding to what Stephanie and both Samuel said, you know, they both talked about how hard it is for recently diagnosed patients to diversify their food options. I mean, this is a huge life change, and something really special about CommuNutri is that we want to take that weight off their shoulders and let them know, like, I know it's a scary process that you've just been diagnosed with something with such a big life change, and we're here to help you with, you know, your daily routine of what to eat. And it's really, you know, to help the patient understand that it's a lot less scarier than it looks, and that there's someone there other than just a diagnosis to help them get through this event in their life.
One of the things that I've lived it was that, being a traveling consultant, it's difficult to find appropriate nutrition. And I think Nicole touched on it, and Stephanie did, that, with her father, it's easy to just chime out and say, you need to eat right. But, you're curbing behaviors that people have adapted for years. My family, they're not from the States. And so with our food, it's very heavy carbs, a lot of rice. So, it's retraining how to, eat within your culture, in a healthy kind of format. And so we're thinking with this application and providing it, as Stephanie mentioned, bringing in the nutritionist, they're with you essentially 24/7, that, we can offer some really great alternatives.
Just throw the question out there, which is really about how does CommuNutri bridge that cultural gap in terms of meeting the needs that is like modified, dietary needs that is modified to a person's culture, race, ethnicity, etc.
Our team is very diverse. Like even through the video, you can see that we all have different backgrounds, and it's very apparent that like each of us have a different background, and our families have different traditions in different food, and food tends to be like the way individuals communicate in the past or even right now. So I think with CommuNutri, we were really hoping that we don't want you to lose that sense of family and tradition in the foods that you are eating. We just want to be able to offer you alternatives or ways to improve what you're eating, so you still get the taste of the tradition, but you're also addressing all the health needs and nutrition needs that you need going forward with your lifestyle because of this big change of being pre-diabetic or diabetic. And we don't want diabetes to take over your life. We want it to just become another path in your journey that you just have to address. And we don't want to make it difficult. We actually want to ease the discomfort that you might be having with trying to figure out, like, if you're trying to make a meal for your family, you want to make something that's traditional, and you don't want to just go for the standard salad. It's just, we want to give you the option that you can give something traditional, but you still address what you're currently needing for your own health.
I think one of the other things that we'll also think about is having people submit recipes. We talked about this during our brainstorming, but we wanted people to adapt, this app is as much for them as it is for, other folks. I think the goal is not to make it top down, that biomedicine or nutritionists hold all the answers. They're there as guides. And we know that there are plenty of healthy foods that people, across the country, across the world have. I mean, traditional diets from wherever often are healthier than the sort of more processed foods that we kind of go to for ease. And I think that that's important to say, that, we can't tell people that what they're used to is wrong. Like, that's just not going to work. That's not going to get people to use the app, and it's not going to make people feel good. So we're trying to bridge that, to say what is good, and these are ways in which you can just change it a little bit for your current status.
How do people lead a healthy lifestyle through a balanced diet or good nutrition? Anyone wants to take this?
I mean, again, I gave the analogy of when I was in the hospital. And it's funny because my brother-in-law, who's a nurse, and I chuckle. It's like an inside joke, because we're like, when you're getting admitted in the hospital, you're eating appropriately, you're feeling good, you're looking good, right? All within the hospital care. And then there's a direct, a parallel when you leave the hospital. It's like you revert back to bad habits, right? Your organs start to act up. You don't feel as good, right? You don't get you're not energetic as you used to. So the balance is that with our platform, we will have a new nutritionist build out per diagnosis, a particular meal plan. In addition to that, the application will also have a nutritionist consult. So in the case of where Stephanie and her dad, and maybe, he's trying, the application and things, he wants to ask questions about whether or not he should tone down on the carbs, or should he beef up his protein, he can go on the application and get telehealth, which is a huge thing now, and have a consult with this nutritionist to kind of gauge that. So, we're giving this access where, you would assume because of the insurance that people have that you should have access to these services. We're actually bringing it to you right there where it talks about not only, getting these people there, but also recipes and getting these meal plans delivered to you.
Yeah, also a healthy diet, I think a lot has to do with consistency. It's not just eating some grains and clean protein one day and 3 eating junk food. And I think that's a struggle when being recently diagnosed for, say, with diabetes, because you don't know a lot of things and it becomes overwhelming. And even I, who don't have diabetes, I know when I try to start a diet, I'm like, oh, this is too much, and just end up eating whatever I want. So that is something we want to help with CommuNutri and make it accessible and let them know that, like Stephanie said, yes, you can eat a donut. It's just, when can you eat it? How many times a week can you eat it? So that's something we really want to focus on and let them know that, eating healthy isn't just eating clean and not very good food. It's just about consistency.
I think to add on that, one of the other things that as a team that we've been brainstorming also was the scalability of this idea. And we really want to incorporate the community aspect of it, because even with COVID now, you're physically distant, but that doesn't mean you have to be socially distant. We want that community aspect to show that you're not alone in your journey right now. There's others out there who have experienced it or are also experiencing what you're doing, and they can share thoughts. And I think in terms of scaling this, we don't just want it to just be focused on diabetes. We want to also in the future address other chronic conditions and also incorporate the physical aspect. Is there other ways that we can leverage our platform to offer you experiences where it's not only your diet that you're focused on, but can we offer you other ways for you to be more active and address the exercise portion of your lifestyle as well?
I just want to add there again, consistency with the new health plan. It helps if you have really that support system around you. With CommuNutri, we're also trying to build this ecosystem where we would have other diabetic patients also. We can talk to each other, or other pre-diabetics. So if you find yourself in that place where there are other people going through the same thing and they can give you ideas, this is what I'm doing, this is what is working. I think psychologically that helps you maintain that consistency that Daniela talked about, that also Nicole also mentioned.
So we know that this idea behind CommuNutri was formed at this hackathon. Tell me what it's like to participate at a hackathon. It seemed very high energy, but I was on the other end of it. I was not actually creating an idea from scratch. So what was that like? Your team is diverse. Let's begin there. So what's it like working with diverse folks that you're meeting for the first time, creating an idea that didn't exist before?
Yeah, I can kick it off. So I've been involved in application challenges. The difference between something like that and with a hackathon of this magnitude was that you have to pitch your problem, right, to strangers who you've never met, okay? And then when you pitch your problem, you have to kind of say, here is my idea, and try to come together, right, to come to some sort of common, I guess, a goal to kind of get your idea up and kicking. As a developer, and even working with electronic health records, we tend to work in silos, right? So if I'm developing an application, that's all I'm doing. This is the first time, not that I've worked in a team, but in this amount of collaboration with folks who I've never been introduced to prior, understanding how people what are their strengths, weaknesses, how everyone gets along. But it's an experience that I definitely learned from today. I brag about. This is a skill set that I feel like, wow, I can actually, engage different teams and pull them together to think of ideas. So that's what I took out of it.
Thank you, Carl. Anyone else?
I'd like to add that as a freshman in undergraduate school, it was definitely scary because I thought, well, gee, I don't really have, any experience with this. I'm not really into the healthcare world yet. And this is also a huge thanks to my team. Even though everyone is at different life stages and has different professions, everyone was very welcoming and really did treat everyone as an equal and never downsized or upsized anyone. So that was something really special about this Inventathon.
Thank you, Daniela. Anyone else?
I really love that the Inventathon model was really horizontal. By that I mean anyone can come up with an idea, whether you're a high schooler or in a university or you're a specialist in some anyone could come up with an idea, and also not just an idea, but form a team around that. So that was really special to see that everyone had a voice, and working with an interdisciplinary team that you meet for the very first time with different views. But I think we put it out well, and it was really great being there.
I echo what all my teammates said. I think like it definitely being on a diverse team, like the cross functionality and like the different perspectives we brought was really fun, as well as the fact that because it was a short time, no idea was thrown out. And I think that's what really benefited CommuNutri, is that any idea we came up with, people just were like, okay, jumping on it, and we just kept pushing it further. And definitely kudos to the OHSU team, as well as the mentors that were there. Some of the questions that the judges asked us during the pre-pitches when we were practicing really motivated us to think of different solutions on how to address what they were asking, but also added to our moving forward of what CommuNutri would be and the platform and how we could add more to it.
Stephanie, any thoughts, or should we move on to the next question?
I'll just say this really quickly. It was also my first hackathon, inventathon, all of that. So Daniela and I were like kind of the same in that respect, even as I'm like a postdoc. But I just really want to say that I'm really thankful for being just sort of brought in. I think everything that my teammates said, that we just, it was really horizontal. We leveraged all of our strengths. I mean, there wasn't a very clear path to, what each of us was doing, but we just kind of naturally gravitated to something that we were interested in or felt good at. And all of those strengths kind of came together and were solidified by, folks saying like, great job, actually, let's put it this way, let's work together on this. It was a really wonderful experience.
Something that helped the development of this app would be that it was such a short time, and when you're like, there were so many participants, so I would say that definitely gave us a very big adrenaline rush.
Speaking of adrenaline rush, and I also messed that up, how do you keep this momentum going? How do you actually bring this product to market?
From a developmental standpoint, one of the first things that we do, we and I'm going to put it out there. At one point, we didn't think we were going to win, right? We were all kind of conversing in the back end, and we thought, okay, hey, we have something going on here, but we may not win. And but we were convinced that this is not the end, right? So we already set up, hey, we're going to meet. In fact, our first team meeting is next week. And so we just decided, hey, we're going to have definitely a clinical team, we're going to have a technical team, and we're going to have a business team. And, I gave very high level of the team about, well, when you develop applications, here is what will happen. I'm pretty sure that, the business team will say, well, from a business standpoint, this is what's going to occur. And then, Samuel and our clinical team, will say, well, from the workflow, this is how we will have to do it and come together. So the Inventathon never really ended. It's evolved into something else.
Thank you all so very much. We're almost at the end. And I guess my question that I had written down was, where do you go from the competition? I know many of you have touched on it a bit, but where do you go from being in the competition, winning the healthcare disparity prize? We're in a moment where people are recognizing that healthcare disparity exists, health inequity exists, diet is very important, nutrition is very important. You have this idea, but where do you go next? Where do you go from here?
I think Carl made a good point. Like, I think as a team, like we're meeting next week. I think for us, like you take it like a day by day, week by week thing. And I think a lot of the, some of the speakers that were at OHSU who were successful from their eventathons also, they mentioned also that the first step that they took was just meeting bi-weekly and having that consistent meeting to just keep talking about it, keeping the energy flowing, the conversations flowing. And even we're already discussing and thinking about the OHSU post-hackathon that's supposed to happen next year. So we're excited about that in order to really get awareness out there. And I think the doctors on the team have mentioned that they are very evidence-based in their thinking. So I think the next steps that we would go is really collecting that user data, really understanding the market and seeing like who out there in the rural areas are looking for if this project is viable in those areas, and really understanding the the current, I guess, settings and the environment that we're living in right now, and really getting to understand what the pain points are in the system, because we have a lot of ideas for CommuNutri, but I think for us, we really need to solidify, like, are we addressing the specific needs that are asked for in the market right now?
Anyone else?
I guess I should say, I mean, to your point, that one of the pieces that drove me to participate in this track for the Inventathon and also to, join this team was that we were trying to make sure that this, very widespread, but still disease of inequity, because I mean, diabetes at the end of the day is really more affecting of particular lower income peoples or people of color, that be front and center in what we do. And I mean, that's a goal, sort of like a personal career goal of mine. So I think that that's also a big part of what I hope that we continue to do, is to call attention to this, because this is an issue that affects certain populations more strongly than others.
What is your call to action on how people can be empowered through diet and nutrition or otherwise?
Yeah, so I think, again, I go back 3 years. With this application, I wish I had it. It would have empowered me to get access to healthy foods, to ideas that I can. I'm also West Indian, so, healthy ideas to substitute white rice with cauliflower rice, perhaps, or, other kind of solutions out there. It would have empowered me to reach out more to nutritionists and not very much heavily kind of rely on the medications and the metformins, right? And to really kind of get start with the basics and the healthy meals.
What CommuNutri can do is super important. And I think that, for some people, they might have that already, but it's really important to kind of spread that awareness. And this is a platform to do it. So, making sure that people can adapt their healthy lifestyle to, or at least recommended healthy lifestyles to them, and also share that experience with other folks. Say, this worked for me, maybe it'll work for you. So we're hoping we can do that. And if people are doing that already, then that's great. We hope that they'll use the app and do it more.
Adding to what Stephanie said, this is definitely not only, a mini portable fridge through your device, but this is also something that we want to be CommuNutri, to be a sort of support group for you. You're not the only one going through this, and this is how other people are dealing with it. So just that overall knowing that you have support and someone who cares and wants to help you.
To what my teammates have mentioned, CommuNutri is that platform that we've hoped to provide reliable information to individuals who might not have access to it. So really, I guess in terms of empowering them, just stay positive and optimistic about it. I think a really good saying, it might be cliched at this point, but like, the diagnosis does not define you. And it's like your lifestyle, you have the power to make your own decisions. And we're just giving you the tools to have easier access to making some of those decisions and getting access to some of the produce and fresh nutrition that you might be in your area that you might not know of.
CommuNutri really empowers the patient to take a control of their own health, of their own treatment, the management of their condition. Again, it's not only based on what the doctor says. It's not the doctor that has full control. But having this platform, I think it really helps the patient to say, okay, I know where I can get this. I know how I can manage this condition. I know what I can eat. I know where I can get it, and I know how I can eat things that I love, but still in a healthy way. And in my experience, whenever I feel like patients are more involved in the decision-making or in the management of their condition, the outcome is always stellar. If it's just one side that the doctor saying this, that, and that, it doesn't usually work. But when the patient is empowered, it's a better outcome for everyone.
The last and final question is, where can people learn more about you, either as individuals or as a team?
For the masses out there, CommuNutri.com is coming out with some content And slowly but surely, we're going to add as we progress in defining CommuNutri and the application and the clinical studies. We'll definitely put that out there.
And I just want to add, in terms of the whole innovation mindset that we're all in right now, if there are experts out there or individuals who are specialized in having more knowledge of the current situation of living in the rural spaces, of having diabetes, like, we would love to talk to you and get more insights from yourself, as well as if you're a user, if you're, I guess not user, but if you're experiencing diabetes and you have concerns, or there's things that you feel that CommuNutri can help you address and some of the needs that we can help address, please do also mention those, because we're always looking to understand more of what's actually currently out there and how we can CommuNutri can help benefit the individuals in the world.
So thank you for taking this time, and thank you for this opportunity.
Thank you.
All right, sounds good. Thank you.
Sure. Have a great day, everyone.